Welcome to the WRAL Daily Download. I'm Luis Hernandez. If you have an emergency and you need an ambulance, the expectation is you'll get the help you need fast. In Durham, that's not always the case. WRAL has reported consistently on staffing issues, especially with the growth of the city and county. WRAL Investigative reporter Sarah Krueger joins us now with new information. Thanks for joining us, Sarah.
Yeah, thank you for having me.
So let's go ahead and start with the basics. How bad is the staffing problem for Durham EMS right now?
So it's not great. I interviewed for my story the director of emergency services for Durham County. His name is Mark Lockhart. And he said out of 179 positions that they have for Durham EMS, 39 of them right now are vacant. So that amounts to about 22% of those positions with no one in them.
Okay, so that seems like a lot. That seems like a major problem. Now let's take that and combine it with the new information that you're reporting on. What kind of have you discovered recently?
Yeah, so I've been aware for years really about staffing issues within Durham EMS, and not just Durham EMS, within a lot of EMS agencies. I mean, this is a nationwide issue really of a staffing shortage. And so knowing about that, and we've done reporting on that, I filed a public records request with Durham County to ask for a lot of data related to overtime spending as it pertains to Durham EMS. And I filed similar records requests in other counties in our area as well, and I'm waiting for those numbers back. But what we do have right now are Durham's numbers, and what they show is that just on overtime alone in the latest fiscal year, which ended in June, roughly $1.7 million was spent just on overtime alone for Durham County EMS. And that number really blew me away. And then the next number really blew me away, which was that the number of hours worked. I asked how many overtime hours were worked among Durham EMS staff. More than 34,000 overtime hours alone. And so the highest overtime earner made more than $42,000 just in overtime alone. Equally surprising to me, all of that did come in under budget. The county had budgeted $1.9 million for overtime and, spent roughly $1.7 million. So I think what I take away from these numbers is just, there's such a heavy load on a relatively small amount of employees, and it just makes you think about burnout. This is a very demanding job, physically, mentally, emotionally. And while overtime is great in the sense of yes, it's great to earn extra money. That's a lot of hours that are worked. And, I just think these people would like some help. And it's we're fortunate that they are working all these hours, because without them, there wouldn't be as many people to respond to emergencies. So they are helping keep ambulances on the road, but it comes at, a toll to them.
Right. And this isn't a job that is, very insular. It's not something that only impacts a couple of people. This is something that's dealing with public health and public safety.
Yeah. And just every day, you don't know what you're going to get called to. And yeah, it's a very taxing job.
You spoke with Durham County's Director of Emergency Services, you mentioned. What's his reaction to, that kind of information? Does it just kind of reinforce what these previous conversations have been like, just with how many staffing issues there are?
Mm-hmm. So he told me that, he was actually not surprised by the number of overtime hours that were worked, because, he's lived it and he's seen it for the last year. But he did tell me he was surprised that they stayed under budget, because, he was aware that it was an enormous amount of overtime hours that were worked. And I asked him questions about, how do you make sure your employees are okay and they're not getting burned out. And he said they really try to talk openly within the department about mental health and try to prevent burnout. He talked about how they have a peer-to-peer support program where if they've had a tough day or a tough call, they can talk that through with a colleague who really gets it and who has walked the walk as well. And then, little things like he said, therapy dogs will sometimes come to the EMS stations, and that's always popular as well. So, he's aware of the risk of burnout, and they're trying to combat it as best they can.
What are the consequences of something like this? These employees being stretched so thin?
Yeah, I mean, I would think it could be hard for them to maintain focus, to not, to feel overwhelmed. He did say that no one is required to work overtime. So, I mean, all these people who are working these overtime hours, it is voluntarily done. And thank goodness again that they are working these hours because they're keeping the ambulances running. But it just does not seem like it's necessarily a sustainable solution to have this many hours of overtime work.
Let's take a quick break there. When we come back, some possible solutions to Durham's EMS staffing problems. Welcome back to the WRAL Daily Download. We're talking with WRAL investigative reporter Sarah Krueger about the staffing problems for EMS in Durham. So, Sarah, speaking with the Director of Emergency Services in the reporting that you have done in general, what kind of resources does Durham EMS need? Is it more people? Do you need more ambulances? What are we looking at?
So, yeah, it's really both. The term that they use is they say we need more units. And when I was interviewing him, I said, okay, so by units, do you mean literally the physical ambulances and the people to staff them? And he said, yes. So it is very much a need for both the people and the vehicles. And one interesting thing that he told me that I was not aware of is he said that the pandemic still having a really big effect on the ambulance industry in the sense of, like making the ambulances, which are very obviously complex and expensive vehicles. But he said if you were to order an ambulance today, it would not arrive in Durham for 3 years.
Wow.
So that's just, yeah. I asked him if we had already ordered any as a county, and he said we do have some on order. So I guess that's good that they're in the pipeline. But he said each ambulance costs about $500,000, and then you wait 3 years to get it. So you just kind of always feel behind.
Wow. That is not a number I would have expected.
Right, me neither.
What's kind of the core? What is the core of this problem here? What is the main root of this problem that's leading to these staffing shortages? Is there something that the county can be doing to fix this problem?
Yeah, so I asked him, is this a pay issue? Would more money solve this problem? Would higher salaries solve this problem? And he said that Durham salaries are roughly comparable with area salaries. He said, some places pay a little more, some pay a little less. And to him, that wasn't really the crux of the issue. He said that retention here in Durham County EMS has improved. But by and large, when people are leaving, he said they're not leaving for other agencies. They're just leaving the business, if you will. He said most commonly people are going to PA school to become physician assistants, or sometimes leaving for medical school or nursing school. So really, I guess the root of it is like a lack of interest of people who are wanting to go into this profession. And that's such a hard thing to fix. He did say that a new academy has started this week. So some relief is on the way. There are about a dozen people starting that academy right now. It will take, the onboarding process, though, is about 2 months. So, it's a long road, but at least that is some progress in the right direction.
Is there anything else that the county is looking at here to fix this problem, Sarah?
So Director Lockhart said the county did just approve 12 additional positions for EMS in the budget, and that's great. He's grateful for that. He did say that's probably not enough. He would love to see more. Again, though, it's hard to ask for or get more positions when you're having trouble hiring for the positions you already do have open. So really, what we need here are more people interested in working for EMS.
That's WRAL investigative reporter Sarah Krueger. Sarah, thank you so much.
Thank you.
I'm Luis Fernandez. Thanks for joining us, and thanks for listening to the WRAL Daily Download, and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.